When being posed the question, what makes educational and school psychologists leaders in evidence-based school intervention, I feel like it is important to fully understand and grasp the concept of evidence-based practices before determining what makes educational and school psychologists leaders in this area. When looking for the definition of evidence-based practices, or EBPs, I found several definitions. Hoagland and Johnson define the term as a body of scientific knowledge defined usually by reference to research methods or designs about a range of service practices such as referral, assessment, case management, therapies, or support services. A knowledge base that is being generated through applications of specific inclusions criteria and describes the impact of services. For example, this may include design types or types of outcome assessments. I found the article Unraveling Evidence-Based Practices in Special Education to be on point with the claim that the term evidence-based practice is commonly misused. The article explains that the term is used synonymously with research-based practice, best practice, recommended practice, etc. The misapplied use of the term has aided in furthering the research to practice gap of evidence-based interventions. Intervention, implementation, and prevention strategies play a major part in the job of a school psychologist. Intervention effectiveness is of key concern when assisting teachers and working with students. Evidence-based practices or interventions have determined their effectiveness and should be used when working with students in schools. However, Cook and Cook explain in their article, Unraveling Evidence-Based Practices in Special Education, that effective interventions are not being implemented in the classroom despite reliable research which shows specific interventions to be positively impacting students. Conversely, other practices that have no impact or in fact have a negative effect on student outcomes are being applied frequently. Theories, methods, and models used to drive the development, refinement, and testing of EBIs do not mesh well at times with the exigencies of community-based services. Lack of training or understanding by the individuals at the campus level, low acceptability on behalf of the faculty, financial resources from the district, administrative barriers, or clash of theoretical paradigms all contribute to the research to practice disconnect. Cratchewell and Chernoff describe 5 assumptions regarding the integration of evidence-based interventions into practice. The first assumption being the need for shared responsibility of the development of interventions, active involvement of practitioners on EBI task forces, participation in practice research networks, and evaluation of EBIs in the context of the school environment are all avenues that researchers, trainers, and practitioners can share in the role of integrating and implementing EBIs. A second assumption is the need to develop and use evidence-based practice guidelines. Due to the generalization from research to practice not being an explicit process, the use of a manual or procedural guidelines can facilitate and support the implementation of interventions and evaluations in practice settings. A third assumption is the need for enhanced practice guidelines. To ensure effectiveness in the use of interventions, enhanced practice guidelines that highlight a specific issue within the context for which the intervention was designed may be a necessary support. A fourth assumption is the need for professional development to assist in the application and dissemination of effective interventions in specified practice settings. And the last assumption shared is the need for a scientist practitioner model to strengthen evaluation of intervention outcomes. Establishing clear guidelines for implementation and evaluation of interventions is one method of operationalizing EBIs at the school campus level and promoting the use of EBIs. Developing a practice research network will help individuals better understand effectiveness of interventions. Creation of professional development opportunities for practitioners and researchers where individuals can express concerns and offer suggestions to one another in a quote-unquote safe environment is helpful as well. Collaboration with other professionals, including but not limited to faculty, administration, district leaders, as well as educational and school psychologists, also guide the use of EBIs in practice. Schools are the largest provider of child mental health services, according to Burns et al. 1995. In many cases, this school environment is the only environment where a child may receive mental health services and interventions. According to the Data Watch, more than 3/4 of children receiving mental health services were seen in the education sector. It is critical that these children receive high-quality, effective prevention strategies and intervention support services to best assist them in meeting their needs. Educational and school psychologists know that evidence-based practices and pedagogical decisions regarding diagnosis, assessment, and intervention have significant potential to impact education in a positive and meaningful way, and therefore are leaders in evidence-based school interventions.